Thousands of men in England and Northern Ireland are missing out on a life-extending prostate cancer drug that's available free on the NHS in Scotland and in Wales. Although not a cure, Abiraterone can help stop prostate cancer spreading to other parts of the body. In England and Northern Ireland, the NHS will only provide it for men with very advanced disease when other treatments have failed. Our health editor, Hugh Pym, reports.
I was very shocked, and it's changed the way I feel about a lot of things.
Still swimming and enjoying other hobbies, Giles was diagnosed with prostate cancer in March. He was told a potentially life-saving drug, Abiraterone, was not available on the NHS in England, so he's opted to pay for it privately. But in Scotland and Wales, the drug is provided to NHS patients.
I feel very, very fortunate that I can afford it. I think it's outrageous that there are men in England who aren't getting this, who can't afford it. It's not about cost. No one seems to be disputing the science. It seems that it is just a bureaucratic process, which is kind of unbelievable.
The drug Abiraterone is only available to the sickest patients. That's what it was originally licensed for. Now it's a lot cheaper, and new research shows it can be effective for men like Giles, whose cancer hasn't spread. The drug was originally developed at this Cancer Research Institute, which now wants it more widely available. The Scottish and Welsh governments have cut through the red tape and given the go-ahead for more men to get it.
It's in a grey area. It's classed as repurposing of drugs.
And how frustrating is that for you and colleagues?
Well, clearly it's very frustrating because this treatment has been through the same sort of guideline process within most of Europe and North America, for example, and of course patients are very aware of that.
The Department of Health covering England said it understood the frustration of some patients who couldn't get the medicine, and the NHS would review wider use next year. David, who lives in Edinburgh, believes Abiraterone has made a big difference combined with other treatment. He was diagnosed a year ago and soon afterwards started getting the drug through the NHS in Scotland.
It was an essential part of the treatment that I had, and probably was the most significant factor in a successful outcome.
Cancer charities are pushing for a change in England and Northern Ireland.
So for men newly diagnosed with localised and high-risk disease, this drug can halve the risk of them dying of prostate cancer. So this is a life-saving treatment.
Giles, who's paying £250 a month for the drug, says there's no excuse for further delay.
We in England still haven't got it approved. Thousands of men in England could have benefited from Abiraterone, and they are twice as likely to die as they haven't had it. The government and NHS need to work out what the hell is going on and get it sorted now.
Hugh Pym, BBC News, Sussex.